Hey all, welcome to Self Massage Video 3. Today I'll be covering some techniques you can use to relieve tension in your neck and your shoulders. Before I begin, just a brief cautionary note. Please avoid massaging the front part of your neck, anything deeper than the sternocleidomastoid muscle. You won't have to worry though because I will not be doing any techniques on this area of the neck. There's a lot of arteries and veins there. That's the reason why. So let's begin. We're going to start with some stretches. First, you're going to take one arm and then you're going to reach to the opposite ear like this, and you're just going to pull down to the side, and then you can make it deeper and pull the other arm away if you'd like. Great, we're going to switch sides. Feel free to hold this longer if you'd like. And then for the back of the neck, clasp your fingers together and then push down on your head and tuck your chin. And then we'll just do a few quick head rolls, neck rolls. This always feels good. Great. So I want you to clasp your fingers together like this again, interlace the fingers, and then flip so that your thumbs are pointing down. So we're going to be pushing like this in the side of the neck, so a little bit in and down. I'm going to show you like this. So have your hands clasped together, and you're just going to be pushing in and down the neck, back of the neck, and then all the way back up. You can repeat this more times if you'd like. Great. Now, from the front angle, we're going to start near the mastoid process, right below the ear, and there's usually an active trigger point for a lot of people here. So you can just push in. I usually use my index fingers or my thumbs. And if you find a tender spot, really use that good breathing and it will really help. So then I just trace this sternocleidomastoid muscle. And you can do circles here if you like, as long as you don't go on the front part of your neck. Circles here, all the way to above my collarbone, about right here. You can also do, as I said, you can just do the singular points that you find and then hold them, as long as you're not on arteries, of course. And then you can also do a technique called cross fibering like this. Next, I'm going to hit the pecs, the pectoralis major and minor. These are really important muscles, especially if you have shoulder tension, to massage that a lot of people neglect. So all I'm going to do are some circles. And you can also lift your arm if you'd like on this. And you should be able to identify the tender spots in yourself. You might be surprised by how tight this feels and that this could actually release tension on your shoulders. But please do not massage your armpit area. And other side, because we always want to do both sides. Great. Now what I'm going to do is I'm going to take 4 fingers like this, and I'm just going to be doing small presses down the shoulder just to the acromion process, this bony landmark here, and back up. And then I can go a little bit lower. Really push in. And then if I can reach, it depends, different people have different capabilities of reaching. You can reach down. I like this technique, squeeze up. So then I like to do this with a trap and squeeze the trap like this. Another thing you can do for the traps is use a C hand, your thumb's like this, and then you squeeze, you push in with your thumb and you squeeze up. Although a lot of people have really tight traps, so this can feel like a lot. So you might want to use the other technique or just go slow and don't use so much pressure. This is more of a trap squeeze. And then, for your shoulder, you can also find some of those sticky spots, and you can either do some circles. If you find a spot, you can always push with your fingers for 5 to 10 seconds and then release. But here you can really just feel it out. And I like to go all the way to my medial deltoid and then come back. Great. I'm going to quickly do this on the opposite side. So again, 4 fingers, the little presses on top of the shoulder to the acromion process and back up. And then a little bit farther back. And then here, scooping, squeezing the traps. Or the trap squeeze. Roll with the C finger and the thumb. And then farther down the shoulder, circles, or pushing in, and then you can go all the way to your medial deltoid and back. So please feel free to do that more times, slower, just going faster for the purposes of this video. Now what I'm going to do is get at my suboccipital muscles, so right at the base of the skull, those muscles which can be difficult to get at, but can really relieve a lot of tension. So I'm actually going to use a chair, which I think most people have in their houses. You can find one which is pointier on the top that works better, like this one right here. You can see this kind of pointy edges, but if not, any chair should work. So I have my chair here. I'm going to turn around, and I'm actually going to sink the back of my head, like the skull, into the chair and let it sit. A note, please, if there's any sharp pain, you should not be feeling sharp pain. It should feel like any normal tension being released when you do a massage. So I'll just show you briefly. Turn around. I'm just gonna squat and then rest my head and then right into the suboccipital muscles, right at the base of the neck. Kind of where the hairline, right above where the hairline is. Usually on most people. And you might feel some sensations in other places called referred pain. That's normal, but any really sharp pain you should not be feeling. It might be higher up than you think. For a lot of people, this also helps relieve, head type tension as well. All right, so obviously You can hold that longer if you'd like, but for the purposes of this video, just keeping it short. So those are just some techniques I like to use to relieve tension in my neck and shoulders when there's nobody else that is there to massage right now, unfortunately. But I hope that this was helpful. And as always, all comments and feedback are welcome, and hope that you all are doing well. Take care.